welcome back to Open, everyone. So the topic of discussion, of course, is COVID-19, and as it continues to have a ripple effect that has left people in panic mode and some even without jobs. And so our next guest is the council member of the 16th District and the co-chair of the Women Caucus. And today she's here to discuss the impact the coronavirus has had on the 16th District. Please welcome Vanessa L. Gibson. Hi, Vanessa.
Hi, thank you so much for having me, Rhina.
Absolutely. How has this been on you?
Overwhelming, hectic, nonstop busy. I think I've appreciated in-person meetings so much more. I've been on countless conference calls with the mayor's office, with the speaker's office, with agencies, with tenant leaders, with providers at senior centers, with schools, with principals, with everyone. Because obviously this is something we're learning more and more about. Every day things keep changing with new restrictions, new limitations. The governor, the mayor, the president, everyone's giving updates. And we're just trying our best as elected officials to disseminate accurate information, right? So we want to make sure that people have the resources they need. Food, obviously, meals are really important right now for seniors and elders and those who are homebound. But we also want to make sure that we are encouraging residents to stay home. If you do not need to go outside, please stay home. It's in your best interest because every day there are more cases confirmed, more people that are diagnosed, and you don't know who you're exposing yourself to in your travels. So I think for all of us, we just need the media. We need everyone to help us spread accurate information and give residents guidelines on what they can do to protect themselves and their families.
So when it comes to our community, we know that now they're offering grab and go bags for the students, right, through the public school system, and now they're being offered for the elders, and so it's a challenging time because there's the suggestion of like stay home, but then there's people that are in need who may have to, encounter certain people who may not, and I know that the whole thing about it is that from what I'm reading and learning is that everyone should basically approach this with the mentality of possibly being exposed to the coronavirus, and the idea is to minimize the actual spread of it. And so how do you recommend people go about handling their daily essentials?
So I would say to anyone that obviously needs to go out, you should go to the supermarket as best as you can, but try to get everything in one visit and not multiple visits. For those who are homebound, some of our elders who have physical disabilities, if you can designate someone, a home health aide, your home attendant, to go and get meals for you, that will be great. What senior centers are doing is they are providing grab and go meals, but you have to go to the center. But if you're not able to, they are arranging for home deliveries, which is a good thing. But beyond that, we're trying to ask residents to stay indoors. And if you need to go out, certainly please do and go back home right after. But if you're not able to, then certainly designate someone, a family member. I know myself, I'm making sure my mom is taken care of, my family members, if they need anything, because you have to. The reality is we still have to live. We need food. We need basic necessities. There's a high demand now on toilet paper. So we just want to make sure.
It's sorry.
Toilet paper.
I know. It's just, I know. I get it, but I don't,
Because people are shopping like the world is going to end. They're shopping like things that, eventually we're going to have issues with capacity and supply. So I understand people buying things in bulk because you don't have to worry for the next few days or weeks,
Right. But it's also a question of being mindful and being considerate and operating as community.
Yes,
operating as community. Everybody's operating as every man for themselves. And that goes even with the virus itself. There are people out there who are not really taking this serious enough.
Yes.
There are people out there who are walking around with the mentality that their immune system is boosted enough that they're not going to get that sick. And for me, it becomes questionable because it's the idea is that people really need to grasp the concept of understanding that the human body isn't doesn't have the is that you?
Mm-hmm. Oh yeah,
The human
I
body doesn't have technically the immunity or the natural immunity to combat this disease if you already have compromised immuno problems.
correct.
And
Right.
so and I'm saying this only to just address the fact that, because I'm hearing it from certain people and I'm going, that's great that you're well and that you're healthy or that I'm healthy. It's just a matter of like, well, what about those who are not? And the fact that people don't understand how it's being passed on, and how one day we're hearing this, one day we're hearing it's from the surface. It's kind of like, don't wear a mask, wear a mask. It becomes really overload on information and what to follow and where to go to follow the information and the resources.
Right, right. So the Department of Health has been consistently saying that if you choose to wear a mask, that's fine, but it really doesn't protect you as you think it would. I think more people are doing so because of a precaution, breathing in air as you travel. Wearing gloves is always good. You have to wash your hands. You should consistently have hand sanitizer with you. If you're coughing, you're sneezing, do that into your elbow. And, really, really take all precautions, because the reality is COVID, coronavirus is not airborne, but you can contract it if you are in close proximity to someone who is carrying the virus. But there are many people we know, because we are adding additional testing sites in New York City. There are many people walking around that may carry the virus that just don't know they have it, and they don't yet have the symptoms. A lot of people may have a cold. Remember, it's flu-like, so you may have the runny nose, the sneeze, the cough, and those are very like flu-like symptoms, but it may not be the coronavirus. So what we're also doing is asking people to hold off on going to the emergency room unless you absolutely have to. We don't want to discourage anyone from going to the ER, but ERs are packed right now. And if you are in an emergency situation, obviously, yes. But if it's something you think you have a cold, take medicine, try to rest up for the next couple of days. And then if your condition persists or it gets worse, obviously you should seek medical attention.
And so thank you for sharing those facts. Let's say we discussed the elders, we're discussing different age brackets. What about careers and jobs and women and even myself? I'm a single mom, I'm working, I'm homeschooling. And then there's the small businesses who the economy itself is taking a plunge.
Right. The small businesses are going to take a big hit on this. With the limitations, now restaurants, bars, and lounges are only allowed to serve to go, pick up, or delivery. No more sit down. All the other restaurants are at a 50-person capacity, except grocery stores and supermarkets like BJ's and Costco's and your local supermarket. But the businesses are obviously hurting. What we're doing in the city council, we're working with SBS, Small Business Services. There are a number of grant opportunities that small businesses can apply for today. If they go on the city's website, www.nyc.gov, and they go to SBS, they can access and see if they're eligible. We're also trying to work at the city and state level to postpone a number of payments that are due. The New York City sales tax payment is due tomorrow for small businesses. A lot of them can't pay that. So we know that, and we're trying to provide a lot of tax relief, because we know businesses cannot afford to expend so much capital right now when their revenue is so low. So we're working with the city on that, with the state as well. We're trying to expedite payments from OMB, Office of Management and Budget. This is the agency that actually approves all of our contracts. So we're trying to expedite payments to all of our not-for-profits, our service providers, folks that are doing the work now that are not getting paid on time. They have to be paid. Cafeteria, custodial staff are working overtime and they need to be paid. A lot of our not-for-profits, like the Cornerstones, they've sent staff home for those that can work remotely. But if you can't work remotely, you should still be paid for your work, right? Even though you're not working. And so we're trying to work with DYCD, DIFTA, and all the agencies to make sure that there's clarity, That's one thing I've heard consistently across the board, is that people have not been given guidelines from the agencies on how they move staff to remote internet access, laptop, working remotely, but also guidelines if you're home, are you still being paid for your work?
So thank you for that. And just before we go, how long do you foresee this even, like, because what concerns me is obviously the hit, but then there's the hit, or there's that curve that everybody's talking about that we're trying to prevent from really being really high. However, right. What about the recovery? You know, what are we looking at?
So we've asked that question. We were on a conference call earlier, elected officials with DOHMH, and we asked one of the doctors, how long do we have to deal with this? Because we know it's going to get worse before it gets much better. But I've been saying consistently, and this too shall pass. I know we're going to get through this. During these great times of challenge, it's so grateful to see businesses coming together, offering to serve meals. Like, I've never seen such resiliency from Bronxites and New Yorkers, and it makes me proud as a Bronxite and a New Yorker. I honestly don't know. No one's really given a real definitive time frame, but I definitely know we're going to be dealing with this over the next few weeks at least. This is probably going to take us through April, which is why the mayor has said that schools may be closed for the rest of the semester, because at that point, if we're getting into May, it doesn't make sense to bring our kids back to school. Same things for us at the council. We have a budget that's due July 1st, and our hearings have been halted. We need to continue moving, so we have to find a way to get the process moving so that agencies are given their budget starting July 1. There's going to be a tremendous amount of need from the federal government because of the loss of wages from businesses, from not-for-profits. Mass transit has seen a 60% decrease in ridership. So everyone is going to have their hand out asking for federal assistance. We're going to need a stimulus package, no question on that. We're going to need help from Albany. And so, you know, I say that we need to just deal with this as best we can every day. Assure New Yorkers that we're going to get through this. Share correct and accurate information. Also want to say one thing we learned yesterday from DOHMH. There are fraudulent people out there that are knocking on doors that are talking about giving testing for coronavirus on site. That is not true. No one should be knocking on anyone's door offering to do testing. That's not accurate. So we want everyone to know, if someone knocks on your door and they offer to test you, it's not true. Do not open your door, turn them away. Don't share no information. Don't give them anything. And if you feel your safety is in jeopardy, call 911, because that is not true. We will have additional testing sites that will be appropriate, that will be defined, that will be finalized through health department, through community-based health centers, as well as our hospitals. No one should be knocking on anyone's door offering coronavirus testing.
Thank you. Mm-hmm. Thank you for all of that. And thank you, most importantly, for just really being a stand for strengthening our community's resiliency. Thank you.
Thank you. Yes, absolutely. Thank you, everyone. And most importantly, stay safe out there. Use every precaution to protect you and your family. If you have to go out, be safe. But if not, stay in the house.
That's what we're saying. That's what we're saying to everybody. Thank you for your time, everyone. Once again, that's Council Member Vanessa Gibson of the District 16. And for anyone interested in Vanessa Gibson's office, they're currently closed, but she is committed to helping the people of the 16th District. And so you're welcome to send her an email at District 16 Bronx at council.nyc.gov, or also you can also go to council.nyc.gov/District 16.
Yes,
thank you again.
And you can call our office too, Rhina. Our office phones are forwarded to our cell phone. So if you call 718-588-7500, you will get one of our staff, one of my teams.
Thank you. And thank you for your commitment to our community. Have a blessed day.
Thank you, Rhina. All right. Be safe. God bless. Thanks, everyone.
Thank you.
Okay.